Imagine you were sick. A little sick. It isn't bad, so you muddle through it. We all do that from time to time. But then, after a few days, it's gotten worse, and you're having trouble breathing. You shiver under your blankets, feeling cold as ice, but you're running a high fever. Something's wrong. You ask a family member to drive you to the hospital, and the next thing you know, you're in an ER bed, and there's a doctor standing over you getting ready to put a breathing tube down your throat. The sedation medication puts you to sleep for what seemed like just a few minutes, but when you woke up, groggy and barely conscious, you realize that you've been asleep for much longer than a few minutes. You're strapped to a hospital bed with white cloth handcuffs around your wrists. To your right is a machine breathing every breath for you through a series of tubes. You've never felt so precariously close to death. You can see the doctor. He looks like he's about 25 years old and indecisive. The respiratory therapist next to him looks about the same age, and he's talking to him about treatment options. Whatever they decide, you have no say in the matter. You're partially sedated, barely awake, and when you try to talk, you find your voice is completely gone because of the tube that's going down your throat. You have so many questions. How long have you been there? Where's your family? Do they know what's going on? And just how sick are you? How much is the bill going to be for all this? And above all, are you going to survive? That's when you notice with dread the respiratory therapist approaching the ventilator, the machine that's controlling your every breath, the machine you are depending on for life. That's not the time to wonder if the respiratory therapist has had adequate training. Voiceless and brain-addled by medications, you can only hope. In these days, when humankind is under assault from pandemic, you need a competent respiratory therapist. Hello, my name is James Inciardi. I'm presenting to the board my proposal for a capstone project aimed at educating respiratory therapy students about ARDS, its pathophysiology, and treatment options. Now, before I tell you about my proposal, I would like to tell you a bit about myself and my professor, Dr. Joe Coyle. Dr. Coyle is a critical care anesthesiologist. He's a Navy veteran who graduated from Drexel Medical College in Philadelphia. Following completion of his fellowship at Massachusetts General Hospital, he was director of critical care at Bethesda Naval Hospital and the director of cardiac anesthesiology and department at Cleveland Clinic. He also worked as a medical director for the respiratory care department in a small hospital in North Carolina. Currently, he's the chair of the respiratory therapy care department at Boise State University. As for me, I am also a Navy veteran, working towards my master's degree under the instruction of some very qualified and experienced instructors, including Dr. Coyle. I've been a respiratory therapist for 6 years, but I have been in the medical field for 18 years as a paramedic, an EMT, a phlebotomist, a CNA, and a ward clerk. I have worked in a variety of hospitals and settings, and just recently I accepted a job offer to the VA hospital in Aurora, Colorado. I'm currently planning on the process of moving my family to Colorado from southwest Minnesota, along with my wife and 2 sons. Since graduating from RT school 6 years ago, I've had a compelling interest in ARDS. One of my instructors was extremely interested in it, and, well, I guess it just rubbed off on me. That's why I chose this project, which will not only allow me to explore my interest in ARDS, but will also allow me to influence new respiratory therapists with the same passion that now drives me. I aimed my project at respiratory therapy students because they're going to be key players in the care of ARDS patients. And as we've seen, competent respiratory therapy is important. ARDS is a deadly condition for people in the ICU. According to a recent study, the mortality rate may be as high as 46%. Not only that, but when tested, many physicians were unable to identify ARDS when shown on a chest x-ray. In today's expense-driven healthcare field, burdened by pandemics that have threatened mankind over the last 10 years, SARS, Ebola, COVID-19, quality training for a respiratory therapist is essential. That's why I have designed a training module using all of the latest studies from a very respected number of publications, including the New England Journal, the Journal of Applied Physiology, CHEST, and others, to create a top-notch education program to teach new therapists. The training module will be done in August of 2020. I will find a respiratory therapy program in Colorado or California that will allow me to teach this module to their students. The class can be given as either extra credit or a mandatory class, depending on the decision of the class instructor. Before I give the instruction, I'll give a pre-test to gauge their knowledge prior to taking my class, and then after class, I'll give them another test to see if they've improved. Lastly, after they graduate, I will email the class members and ask them to take a third test to see how well they remember the material I taught them. The main variable score will be the test scores. I will also keep track of student variables, including prior medical experience, preferred language, and age. My hypothesis is that respiratory therapist students will have a greater knowledge about ARDS following the instruction as seen by higher test scores. Recruitment will be determined with the assistance of the RT program director or the instructor. It will either be given as a mandatory class or extra credit. I will suggest to the instructor that if the students choose not to participate in an extra credit class, then another means of getting that extra credit should be given. Risks and benefits. The biggest risk is that the class will serve to stress students about information that I'm presenting. This stress can be mitigated by informing the students that the full amount of extra credit is earned by attending the class, and the test scores are not going to be reflected on their grades. The benefits will be a class of respiratory therapy students that will be more proficient in their work. Confidentiality. Neither Dr. Coyle nor I will be privy to student class scores. It's none of our business. The program instructor will inform us if test scores are usually high or low compared to normal test scores. All pre-test and post-test scores will be secured under lock and key or by computer password. Here's a list of the variables I plan to keep track of in the test. I will use a chi-square test to determine if these variables are causal to the test. As for the project timeline, I plan to complete the module in August 2020. Ideally, I will give the instruction to the class in the fall or winter of 2020. In the summer of 2021, I'll give the post-graduation test to see what information they retained. Then, in August of 2021, I'll analyze the data. And this is the overview. To summarize my program, the general purpose is to develop an educational module that will help teach students about ARDS pathophysiology and treatment options. It's an experimental, quasi-experimental approach to examine causality. The clinical question is, among respiratory therapy students, will a specialized module describing pathophysiology and treatment of ARDS result in higher test scores and increased understanding? We will use comparative statistics to determine this. I want to talk about 3 lessons that I've learned so far in planning this capstone project. The first lesson that I learned was not to allow the scope of the project to get too big, to keep it reasonable, to keep it doable. Don't get too overambitious, so overambitious that the project will never be done. The second lesson I learned was don't use this project to learn a skill or knowledge that you are not already familiar with. You should already have a good knowledge of the subject matter. Doing this project will make you an expert. I put this in because I first wanted to do this project on skills that I thought were interesting, but I didn't know how to do. The idea was to learn how to do it and then do the project after that. But what I found was that you really have to have a background knowledge of the material before you start the project. Lastly, the project that you start with is not going to be the project that you end up with. There will be changes to the project, and this is normal. I was afraid that by making too many changes to the project, it would jeopardize the validity of the project. But actually, I don't think that that's true. I think that these changes, like the ones that have happened in my case, are all normal, and they've really actually added to the project itself. Thank you for listening to my presentation. Above all, my presentation is aimed at creating a competent respiratory therapist that will be able to deliver when one of us is at the receiving end of healthcare. Thank you.